Comprehensive, relevant, and insightful conversations about health and medicine happen here on MedStar Health DocTalk. Real conversations with physician experts around the largest healthcare system in the Maryland, D.C. region. The MedStar Georgetown University Hospital Stem Cell Transplant and Cellular Immunotherapy Program is the only adult, FACT-accredited program in the Washington, D.C. area. We give patients with cancers affecting the blood or immune system and other disorders access to life-saving treatment options not otherwise available in our region. These include allogenic stem cell transplant, autologous stem cell transplant, and CAR T-cell therapy. Welcome to MedStar Health DocTalk. I'm Ryan Miller, and I'll be your host for today's episode. Today, we're focusing on stem cell transplant and cellular immunotherapies. We are here with Dr. Alaa Ali, clinician, instructor, and investigator in clinical and translational research at MedStar Georgetown Stem Cell Transplant and Cellular Immunotherapy Program. Thank you for joining us on MedStar Health DocTalk.
Thank you for the invitation. I'm glad to be here.
So, what does the Stem Cell Transplant and Cellular Immunotherapy Program at MedStar Georgetown University Hospital offer?
So the MedStar Georgetown Stem Cell Transplant Cellular Immunotherapy Program stands as a regional leader in providing cutting-edge clinical care for both stem cell transplant and CAR T-cell therapies. It's the region's only adult FACT-accredited program, which is a significant endorsement to our high standards. We offer several modalities of treatments for a wide variety of blood cancers and with a very personalized approach. In addition to having a dedicated physician team, our program provides patients with comprehensive holistic support to navigate both the treatment and the survival journey. The dedicated support services include a social worker, pre-treatment and post-treatment coordinators, patient navigators, in- and outpatient nurse practitioners, nutritionists, financial and insurance coordinators, palliative care, rehabilitation treatments. All of those services work together to help patients and families manage the complexities associated with stem cell transplantation and cellular immunotherapy, both during the acute phase of treatment as well as in the long term. Our program is also the only National Cancer Institute designated comprehensive cancer center in Washington, D.C. region. And through our research engine, our patients have access to several clinical trials that are at the forefront of cancer research.
Wow. So that really sounds like our program offers a wide variety of treatments for blood cancers, and they're all tailored to the individual needs of the patients.
That's correct. Exactly.
Speaking of patients, what kind of patients do you tend to see in your day-to-day?
Yeah, so we treat a broad range of patients, primarily those with cancers affecting the blood and immune systems, such as leukemia, lymphoma, and multiple myeloma. But we also help patients with certain non-malignant conditions, such as sickle cell anemia and aplastic anemia.
It sounds like with that broad range, we've got you covered no matter the issue. That's great to hear. So, Dr. Ali, what would you say your philosophy of care is?
Well, it's simple. My philosophy of care revolves around compassion, innovation, and collaboration. We believe in treating the whole person, not just the disease, which means we address both the physical and emotional aspects of health. And by staying at the forefront of medical advancements, we work closely with leaders in the field to provide our patients with access to cutting-edge treatments in the DMV area.
What drew you to cellular therapy, hematology, and medical oncology?
So my passion for cellular therapy and hematology began during my medical training when I witnessed the transformative impact that these therapies can have on patients' lives. The potential to harness the body's immune system to fight cancer is incredibly inspiring. Also, the rapidly evolving nature of this field allows me to continuously learn and contribute to innovative treatments that offer hope to patients with otherwise very limited options.
So you touched on innovations you've seen during your time in this field. Can you speak to some of those? And would you say you're optimistic about the future of stem cell immunotherapy?
Absolutely. So CAR T-cell therapy is actually a novel therapy itself. It was approved by the FDA only in 2017. And it's a curative therapy that people had no access to before that date, only on clinical trials. The journey for CAR T cells started back in the 80s, but it did not crystallize until early 2011, and then eventually got approved in 2017. So the whole field is actually an innovation.
That's great that you guys are always striving for ways to improve patient outcomes. For those who are unaware, what is stem cell transplantation?
Yeah, so stem cell transplantation involves infusing hematopoietic stem cells into the patient's bloodstream. These multipotent stem cells can develop into various types of blood cells, including white blood cells, red blood cells, and platelets. This procedure is used usually to treat certain blood cancers and other hematologic diseases. These stem cells can be harvested from the patient's own body, which what we call autologous transplantation, or from a healthy donor, which what we call allogeneic transplantation.
And can you speak to what the harvesting process entails?
Yeah, so the harvesting entails collecting stem cells from the donor, whether it's the patient or the donor, the healthy donor. And it entails trying to mobilize those stem cells from the bone marrow into the peripheral blood so that we can connect the patient to a machine called apheresis machine that can collect those stem cells from the patient or the donor.
Oh, interesting. And do they have to be put under to be hooked up to this machine?
Yeah, they're connected to a machine. It's an outpatient procedure. It's very simple.
Are they awake?
They are awake. They are using their phones most of the time. It's a long procedure, 6 to 8 hours, but it's an outpatient, so they get to go back home at the end of the day. It takes a day or two or sometimes 3 days to collect those stem cells.
Well, that's great that they can do it and then not have to stay overnight and get back to their lives.
Right, exactly.
What types of conditions can be treated with stem cell transplantation?
Stem cell transplantation is primarily used to treat malignant hematologic conditions such as leukemia, lymphoma, and multiple myeloma. But it's also effective in a few non-malignant diseases such as sickle cell anemia and aplastic anemia. In some cases, it's also used to treat rare solid tumors such as testicular cancer through autologous stem cell transplantation.
So that sounds like most of the body is covered in all of that.
Yeah, it's a treatment that offers a lot of hope to a variety of cancers.
Earlier, I had mentioned we offer autologous transplantation. Can you tell our listeners what that is?
Absolutely. So autologous transplantation involves using the patient's own immune cells, or stem cells rather, which are collected before they undergo high-dose chemotherapies. After the chemotherapy destroys all the cancer cells, the harvested stem cells are reinfused to regenerate the patient's blood and immune system. This method is particularly beneficial for patients with certain types of blood cancers that are responsive to high doses of chemotherapies.
Moving on to allogenic transplantation, can you explain that?
So allogenic transplantation, on the other hand, involves using stem cells from a donor, which can be a family member, an unrelated match, or in some cases, partially matched donor. Unlike autologous transplantation, where the patient's own cells are used, allogenic transplants provide the added benefit of a new immune system from a different donor, which can help fighting the cancer through a process called graft versus tumor effect. There is also a risk of something called graft versus host disease, where the donor's immune cells may attack the recipient's healthy tissues. And that's why we are meticulous about selecting patients for that type of treatment.
What would happen if, God forbid that were the case? What next?
Well, nowadays we have a lot of options for treatments. We have a lot of options for preventing the disease as well. So thankfully, we nowadays have less percentage of patients developing that disease. But also, if they do develop that disease, we have more options for treatment, unlike 10 years or 20 years ago. So from that standpoint, the field is advancing, and we're more able to offer patients this type of treatment that 10 or 20 years ago we hesitated before offering them this treatment. Allogeneic transplantation is often used for patients with leukemia, myelodysplastic syndrome, or myeloproliferative neoplasm, where high doses of chemotherapies alone cannot treat the patient. So that's the main difference between allogeneic and autologous stem cell transplant.
So allogenic can't rely on solely chemotherapy, is that correct?
Right, yeah. You need the added benefit of the immune cells of the donor to try to fight the tumor, and that's what we call graft versus tumor effect.
Well, thank you for breaking that down. Earlier, you mentioned how CAR T-cell therapy is a relatively new offering within the last 5 years or so. Can you walk us through how this works?
Absolutely. So CAR T-cell therapy, or chimeric antigen receptor T-cell therapy, is a revolutionary treatment that modifies the patient's T-cells to better recognize and attack cancer cells. The process of that treatment is that we first collect the T-cells from the patient, and then we genetically reprogram those cells in the lab to target a specific cancer antigen or protein. And then we multiply those cells, and then we reinfuse them into the patient. Once those cells are inside the patient's body, these engineered T cells seek out and destroy cancer cells, and they provide a really powerful and targeted approach to treatment.
Can you explain what types of conditions can be treated with CAR T-cell therapy?
Sure. CAR T-cell therapy is particularly effective for certain type of blood cancers, including cancers such as diffuse large B-cell lymphoma, acute lymphoblastic leukemia, and multiple myeloma. But we're hopeful that we will be eventually able to use this revolutionary treatment to treat other conditions, other solid tumors, but also non-malignant conditions such as autoimmune diseases.
Is CAR T-cell therapy offered for adults anywhere else in the area?
Our program is actually the only program that provides standard of care commercial CAR T-cell therapies in the DMV area at this point. Our program's unique position allows us to provide this advanced treatment to patients who might not otherwise have access to it.
Well, that's great to know we can offer that to patients. If somebody was interested, what are some of the different ways in which someone can become a patient?
Yeah, so patients can begin the process of self-referring themselves to us by directly calling the program at 202-993-0492. Alternatively, their hematologist or oncologist can refer them to one of our transplant physicians. And for the referring physicians, we have a dedicated staff that are here to make the referring process as seamless as possible.
That number was 202-993-0492.
Exactly.
Does MedStar Georgetown offer clinical trials?
Yes, absolutely. So MedStar Georgetown offers several clinical trials for patients undergoing stem cell transplant and CAR T-cell therapies. These trials provide access to new and potentially more effective treatments. They contribute to our mission of advancing medical knowledge and patient care.
Yeah, I think the clinical trials speaks to how you guys are always looking for improvements, never satisfied, that kind of mentality.
Yeah.
You are an active researcher with many publications in peer-reviewed journals. Can you tell us about some memorable research that you've been involved with?
So one of the most memorable research projects I've been involved with focuses on enhancing the efficacy of CAR T-cell therapy, particularly in patients with diffuse large B-cell lymphoma. We know that this treatment offers patients with about 40% chance of long-term remission or cure, and we want to make that percentage even higher. So we look for ways to improve the function of those CAR T cells, and we try to take advantage of the weaknesses of the cancer cell to make them more prone to the function of those CAR T cells. So we have identified a protein called EZH2 in mouse models and in the lab where that protein controls the function of CAR T cells. And if you manipulate that protein, you could enhance the function of those CAR T cells. And we're running some trials to try to test that in phase 1, phase 2 trial.
Does that mean you could have better control of where it's being directed?
You could potentially make those CAR T cells more effective in secreting the chemicals that you need to kill the cancer cells. So there are probably many ways that protein control the function of CAR T cells, but that's one of the most main ones. So we're also trying to study other ways to enhance the efficacy of CAR T cells, which is by combining it with other treatments that, again, allow or enhance the efficacy and the what we call the effector function of those CAR T cells. But those treatments need to be tested, and we're at the early phase of starting all these clinical trials here at MedStar Georgetown University Hospital.
As we've mentioned, MedStar Georgetown University Hospital's Stem Cell Transplant and Cellular Immunotherapy program is the only FACT-accredited program in the Washington, D.C. area. What does being FACT-accredited mean?
So being FACT accredited means that our program meets the high standards in patient care and laboratory practices as set by the Foundation for the Accreditation of Cellular Therapy, or FACT. The accreditation ensures that we adhere to rigorous protocols and provide the highest quality of care to our patients.
It sounds like a rigorous standard that we're meeting then to be FACT-accredited.
Absolutely.
For prospective patients, what should they expect when they come to MedStar Georgetown for treatment?
So when patients come to MedStar Georgetown for treatment, they can expect a comprehensive, personalized approach. We have a multidisciplinary team that provides holistic support, including dedicated social workers, as I mentioned before, patient navigators, nurse practitioners, and financial coordinators. And all of these teams help manage the complexities of the patient's treatment journey. They will also have access to the latest clinical trials and innovative therapies, ensuring that they receive the most advanced care available currently in the nation.
That's wonderful. It definitely takes a team, so that's great. You guys have that multidisciplinary approach. Can you tell us about the team that makes up this program and how they support the patient throughout the process?
Absolutely. So our team consists of obviously high-skilled physicians, nurses, social workers, patient navigators, other healthcare professionals such as rehabilitation doctors, and we all collaborate together in every step of the patient's treatment. For pre-treatment planning, which tend to be a little complicated from a logistical standpoint, we have a whole team of pre-transplant coordinators that ensure the patient stays on track to get them to treatment. And then we provide a range of support services for post-transplant and post-treatment phase, including, again, social worker, nurse practitioners, financial advisors, etc. So it's, like you said, a multidisciplinary, comprehensive team, and it really takes a village to get patients through these treatments.
I love to hear that, and I'm sure the patients will as well. Earlier, we were talking about the future of this field and reasons for optimism regarding stem cell transplantation and CAR T-cell therapy. Can you speak to why you're so confident about what the future holds for this space?
Absolutely. I do believe that the future of stem cell transplantation and CAR T-cell therapy is incredibly promising. We are now witnessing advances in genetic engineering, immunotherapy, personalized genomic medicine, and all of these advances are paving the way for more effective and less toxic treatments. We're also seeing remarkable progress in our ability to cure increasing number of cancers that just a while ago were untreatable. Not only do we have more effective therapies, but we have less toxic therapies, and that reflects into improving the quality of life of those patients. So there is every reason to be optimistic about the future of those therapies and their potential to transform cancer treatment.
I've really learned a lot, and speaking with you today, I've been talking with Dr. Alaa Ali at MedStar Georgetown University Hospital in Washington, D.C. Thank you for sharing your expertise with us today on MedStar Health DocTalk.
Thanks for having me.
To find out more about the MedStar Georgetown Stem Cell Transplant and Cellular Immunotherapy Program, call 202-993-0492 or visit medstarhealth.org/stemcell.